Hip abduction. This is the movement of the leg away from the midline of the body. The following muscles are responsible for initiating the movement: gluteus medius, gluteus minimus, and tensor fasciae latae. Use the appropriate body position as required by the condition of your client or patient. Variation 1. Hip abduction in side-lying position. Tie the resistance band in a loop. Secure the band around both ankles. Note that you may also use a mini band as an alternative to resistance band. Lie on your side supporting your head in neutral position by placing your head on the palm of your hand. Increase your base of support by slightly bending the uninvolved hip and knee. While maintaining an extended knee, bring the foot upward against the resistance of the band. Control the movement as you go back to the original position. Choose the right color of the band for the needed resistance. Variation 2. Hip abduction while standing. Secure the band against the wall, a sturdy surface near the ground, or a heavy object. Secure the other end of the band on the ankle of the hip to be strengthened. Note on the video that the direction of the resistance should come from opposite the direction of the movement. Stand upright, lateral to the wall, and with the supporting foot elevated off the ground to provide foot clearance of the exercising leg. Provide yourself with more stability by holding on to a chair or a table. While maintaining an extended knee, bring the foot outward against the resistance of the band. Control the movement as you go back to the original position. Note that the original position could either have the involved foot in neutral or midline position, or have the involved foot cross the midline of the body in front of the supporting foot. Choose the right color of the band for the needed resistance. Variation 3. Hip abduction in supine position. Tie the resistance band in a loop. Secure the band around both ankles. Note that you may also use a mini band as an alternative to resistance band. Lie on your back with both lower extremities hip width distance apart. While maintaining an extended knee, bring the foot outward against the resistance of the band. Control the movement as you go back to the original position. Choose the right color of the band for the needed resistance.